It's Ogochi Wachuku. I've got an appointment with the nurse this morning.
Yes, I can see you here. Okay, please take a seat. Joe will be with you as soon as he's ready.
I'm Ogochi, and quite recently I found out I've got cancer. I mean, what a shock. It still doesn't feel real, if I'm honest. I'm going to have oral anti-cancer treatment, and I'm going to have it by mouth, or as the hospital calls it, orally, which means it'll be in a tablet or capsule that I'll swallow. I'm feeling really anxious about it, but surely taking it by mouth will be okay. After all, I already take tablet medication for other things.
I'm Joe, one of the nurses who'll be looking after Ugochi. I know she's anxious. Who wouldn't be? Ugochi, I know you have lots of questions to ask me, so I'll do my best to answer all of them and hopefully put your mind at ease.
That sounds good. Thank you, Joe.
The oral medication we're going to give you is called anti-cancer therapy or treatment. You might also hear it referred to as targeted therapy. Anti-cancer therapy may be given as a single medication or as a combination, and you might also have it alongside another treatment such as radiotherapy, immunotherapy or chemotherapy. As your treatment is by mouth, you'll collect the medication directly from the hospital pharmacy and then take it at home. There are many different schedules, and you'll be told exactly when to take the medication. Some of these medications are taken every day, others less often.
Oh, okay. So it's just a case of taking the tablets, as I'm told.
There's a bit more to it than that. First, let me tell you about the steps all patients follow through treatment, or the pathway, as we call it. Before you can collect each supply or cycle of tablets, you'll need to have a blood test, as well as an appointment with one of the clinical team. This might be in person in the clinic, or by telephone or video call. The clinician will ask about any side effects you've had, and they'll review your blood test results to ensure that you're fit to take the next cycle of medication. They may make some changes to the dose to help lessen any side effects that have been bothering you. The clinician may also prescribe extra medication, such as cream or antidiarrheal capsules, to help side effects, depending on what they are. Once your blood results have been reviewed, a prescription for your medication will be produced on the computer and sent to the hospital pharmacy, who will then prepare it for you for collection. Oral anti-cancer medicines are different from other kinds of medicines, so you can't collect them from a high street pharmacy, like you might do for other regular prescriptions.
Oh, okay. So I'll need to come to the hospital's pharmacy. I suppose that makes sense if these anti-cancer therapies are specialised.
Yes, that's right. It's important that you tell the clinical team about any other medication that you take, including herbal medications or supplements. Occasionally, particular combinations of medicines or supplements can interact with each other or with certain foods or drinks, causing them not to work properly. So the team need to make sure that there won't be any interactions that interfere with how your anti-cancer treatment works.
Yes, okay. I'll make sure I do that. Can I ask you, Joe, what you've mentioned, the blood test, then the appointment with the clinical team, and then the prescription, does all of that happen on the same day?
It can do, but the blood test sample can take a few hours to process, and pharmacy can only give you the medication once the results of the blood test are reviewed. So it can end up being a very long day waiting around. An alternative would be to have your blood test up to 2 days before the appointment with the clinical team, so that the results will already be available for the clinician to check. If your appointment isn't face-to-face, the prescription will be sent directly to the hospital pharmacy, and you'll be advised to go there on a specific day to collect the medication. So that might be something to consider.
What do I do if I forget to take the tablets or capsules? I tell you, Joe, my memory isn't as sharp as it used to be when I was younger.
Good question. If you do forget to take the anti-cancer medicine, the best thing to do is contact the clinical team for advice. Never take double the number of tablets or capsules to try and catch up. That's really important, as it may make the side effects much worse. If you think you might struggle with remembering whether you took your tablets, please let us know, and there are things we can do to help. There are medication diaries and planners, and also medication reminder apps, which can be useful.
All right, I understand. Even if my phone is already full of apps to do with this hospital and cancer, but reminders do sound useful.
Okay, we'd ask that only you handle the medication yourself, and it's best to avoid direct skin contact as much as possible. In any case, you should always wash your hands after handling the medication. Also, as with other medications, please do keep them where children and pets can't reach them. If you have any spare tablets or capsules left over, for example because you missed a dose or we told you to have a break, then you should bring them back to the hospital with you and we'll dispose of them. It's really important that you don't save them up and then mix them with the next cycle of medication. And you must not put any leftover tablets or capsules in the bin either, or flush them down the loo.
Okay, understood. Sometimes I worry about swallowing big tablets or capsules. So can I crush or cut the tablets? Or split open the capsules and take the powder out?
No, please don't ever do that. If you're worried about being able to swallow the medicines, do speak to your clinical team. There may be an alternative way that you can have the treatment.
What about if I'm sick? What do I do then?
If you vomit after taking your anti-cancer medication, don't take more of them. You shouldn't take another dose until the next scheduled time. Even if you think you vomited up whole tablets or capsules, you might still have absorbed some of the drug. That's why you need to wait until the next dose is due.
Oh, okay. I mean, I hope I won't vomit. But I wanted to ask you just in case. That's what you think of when you think about anti-cancer treatment, isn't it? That it makes you sick. What should I do if I don't feel well? Like if I really don't feel good and I think it could be something to do with the medication?
When you first start treatment, we'll give you an alert card which has the 24-hour acute oncology helpline phone number on it. You should call this as soon as you can if you don't feel well. There's somebody available to help 24 hours per day, 7 days per week. But if the line is busy, please keep trying. The nurse who answers the phone will give you advice and tell you whether you need to come to the hospital, either to see us in clinic or to A&E. You may be advised not to take any more oral anti-cancer medication until you've been reviewed by the team. This acute oncology helpline number isn't for general questions. It's just for if you feel really unwell. Your specialist nurse can help with non-urgent questions.
Oh, okay. Yes, I see.
There are some potential side effects, as with any medication. Your clinical team will talk to you about potential side effects related to the medication you'll take, but I'll talk you through some common ones now.
I'm listening.
Okay, so the more common side effects include diarrhea, skin changes, nausea and fatigue. But there are others which may be much less common but potentially serious. You'll be given a written information sheet before you start your treatment, which will tell you what the common side effects associated with the medication you will take are. Now, the information will also tell you about side effects that are less common, but that we still need to be on the lookout for. Your clinical team will also tell you when you should contact them with side effects and when to use the 24-hour advice line.
Okay, got it. I'll store that number in my phone.
With some treatments, we'll give you extra medications such as anti-diarrhea medicines or anti-sickness medication to keep at home and take if needed. But your team will tell you if they're going to prescribe these for you, and they'll also explain when and how to take them. I'd call these just-in-case medications.
Okay, Joe.
Many of these medications often cause your skin to be more sensitive to sunlight whilst you're on treatment, so it's really important that you wear sunscreen in the sunshine and wear a hat. For skincare, we recommend a mild unfragrance moisturiser to keep your skin well hydrated, but above all, wear sunscreen.
Oh, okay. Even with my skin tone?
Yes, Yugochi. The skin sensitivity from anti-cancer treatment affects light and dark skins, so everyone needs sun protection.
Right. Okay, that's fine.
Overall, it can help to keep a record of how you feel on different days and any symptoms you experience so that you can inform the team. There's lots of help and advice on coping with symptoms, including tiredness and reduced appetite, for example. Just ask us if it becomes an issue for you. And do accept help from family and friends who are looking out for you.
Okay. And will my hair fall out?
Most of these medications don't cause complete hair loss, but some may cause your hair to thin a little.
Okay, that's good to know. I'll be prepared for that.
It's a good idea to get any routine dental work completed before you start treatment, if you can get an appointment with your dentist in time. But if you do need to see a dentist, you must let them know that you're having this treatment. If your mouth is sore and that's affecting what you eat and drink, you should contact us. Please don't just wait and hope it'll get better by itself.
So on food, do you recommend any special sort of diet?
No, we don't. A healthy, varied diet is good, but eating what you fancy and grazing is good too. And it's important that you stay well hydrated, so drinking plenty of water is a good idea.
What about herbal remedies? Did you say those are okay?
Again, it's important that you tell your doctor or nurse about all medication you're taking before you start treatment, including any herbal remedies or supplements, because they may not be compatible with your anti-cancer medication. But because we can't always be completely sure, most of the time we have to say that we don't recommend you take these.
And alcohol? Is it safe for me to have a glass of wine?
Yes, it is. A glass of wine, drinking in moderation, shouldn't be a problem. Some people say it tastes different, and that's why they cut back or give it a miss.
Okay, that's good to know. And what about going to work? What do other people usually do?
It's a personal decision whether you choose to continue working during treatment, and it will probably depend how you tolerate it. You can talk this through with your doctor or nurse, and also ask your manager about flexible working, in case that's an option. If you need to take any medication during a shift, it's important that there's somewhere to store it.
And what about going to the gym after work? That's my routine, work, then gym. Can I still exercise? Are there types of activities you don't recommend?
It's a good question, Yugochi, and yes, you can still go to the gym. Listen to your body though, so if you find yourself feeling more tired and having less energy, just do a bit less. We encourage people to be active during treatment, and walking is a good place to start.
Right, we do like taking the dog out for long walks at the weekend.
Do you have any other questions, Yugochi?
I don't think so. You've told me a lot today. Oh, actually, yes, I do. It's a bit personal, but can I ask about sex and intimacy? Is it okay to still have sex whilst on oral anti-cancer medications?
Of course you can ask about sex. You can ask about anything. It's fine to have intercourse, but you will need to use barrier contraception, like a condom, to protect your partner from being exposed to any of the drugs, whilst they could still be active in certain body fluids. For some drugs, which we know can cause birth defects, we may recommend you use 2 types of contraception.
Well, my baby-making days are long behind me, but I'll remember to use protection. Okay. And is it okay to take a short break away? We already have a holiday planned, but can we still go?
Usually, yes, but just run this by your doctor or nurse. Anything else you'd like to ask?
No, not at the moment. But I expect I will think of things later. Thank you, Joe.
Okay, please don't be afraid to ask your doctor or nurse any questions. No question is too small. We also have Macmillan Cancer Information and support centres at most of our hospitals, and the staff there are good with hints and tips on coping with side effects at home. They've even made videos you can watch on the Royal Free website. The link to the webpage is in the description of this video below.
I will definitely pay them a visit and remember the videos.
I hope you got you starting to feel more confident. It's natural to be nervous before the first treatment, but nobody goes through this alone. There's a whole team of us right here to look after her during her treatment.
Well, I understand a lot more about my anti-cancer treatment now, but I won't lie, it's still daunting. I suppose I can't know how I'll feel until I actually start treatment. For now, I'm off to grab my notebook and pen, so I can write down some more questions to ask next time. Perhaps you'd like to fetch your notebook and do the same. Or maybe it's just been a lot to take in and you'd like to go through all of this again. Feel free to rewind, rewatch, and repeat as many times as you'd like. You can also share the link with family and friends. I hope this information has reassured you, and I hope your treatment goes well.